So the next talk is Dr. Harshul talk, TAC, Viscoelastics and Hydrostitch cannula, tips and tricks.
Thank you very much. So I'll be sharing some tips and tricks how to use these very small devices, which are small modification from routine cannulas which we use, but they're very helpful. And let me tell you, I don't have any financial interest except that they go by my name, and Epsilon manufactures them and export them also. And I'm using these cannulas, and a lot of people have started using for last 2 years. So this is a viscoelastic cannula, which is modified. Its normal cannula is 23 gauge, but this cannula is 25 gauge. As you can see, it's a total curved cannula. So it's very different from normal viscoelastic cannula which you use. And if you can make out, the end is tapered. Its end is tapered, so that the advantage is that it's very easy for us to go through side port incisions in situation when we need to put OVD, when we need to do visco exchange, like there is an anti-capsule tear, we don't want antechamber to collapse, we need to refill antechamber again and again. So with the wide bore cannula, it's difficult to go through 1.2 millimeter incision of side port. And another cannula which I am going to show you today is a 27 gauge cannula. As you can see, this is these both cannulas are made of stainless steel, and this cannula is bent at the tip. It has a 1 millimeter tip there, which is bent at around 80-85 degree. And this cannula is a multi-purpose cannula. I use this cannula for hydrodissection. I use this for hydrodelineation. I use it to bend down and rotate the nucleus after hydrodissection. And most importantly, it's used to hydrostitch all the walls of the phaco incisions. So let's see these cannulas in action then. So this is on upper side, this side port, I'm inserting this normal HPMC regular cannula which comes, and this one is the small bore 25 gauge cannula. Because of this length here of normal cannula, we can't go beyond anti-capsular axis margin, but here, because of the smooth continuous curve, in many times we need to go towards equator if there is zonular dialysis. And with this cannula, through side ports, you can go in any area of capsular bag. So this is hydrodissection cannula. As you can see, I go normal hydrodissection cannula we go inferiorly to do hydrodissection, but here I bend it on, this is all obviously bent on one side, so I go there, and you can see this wave come out and go on other side and do hydrodissection. And at the same time, you bend it down and use it to rotate nucleus. Another advantage is in softer nucleus where hydrodissection becomes very tricky many a times. It's because of this bend you can easily do hydrodissection in subincisional area. So you just bend it little towards main incision, and this is a very soft cataract where some posterior subcapsular cataract is there. You need to do hydrodelineation. So it has a 1 millimeter bend. You know, if you go inside the nuclear substance, you can never go wrong. So I just go down and keep rotating it, and it does the job of hydrodelineation very nicely, as you can see here. And this pops out. So as I said, that with this, because of the continuous curve of this viscoelastic cannula, you can do visco expression of epinucleus very easily. So you just go there from side port incision and go till the equator, and you really have to go beneath the anti-capsular axis margin towards equator and then push visco. So the entire epinucleus, it comes out. Again, go through this. And even I use it while doing while my phaco probe is inside in posterior subcapsular polar cataracts where I don't want to turn off the infusion. I just go through side port and take out the epinucleus. So this loosens up the epinucleus. Again, one more case, I go from this side port, go beneath anticapsular access margin, see the epinucleus comes out. So it's ergonomically very much suited to go through a smaller incision and go to towards equator of the capsular bag. So coming to Hydrostitch, you just have to rotate your hands like this and you can easily hydrate both the walls of the incision, whereas a normal cannula sometimes, especially in topical phacoemulsification, when eyeball is rolling upward, it's difficult to hydrate both the walls, so it's very useful. So it's just the external video. So you just need to hydrate one wall and then you just rotate it to other side. So very small movements are needed. See, this is the normal cannula. It has a very long this arm here. So when you try to go through from nasal side, it becomes really difficult because exposure is less. So whereas this cannula, it fits in easily in the incision and you can easily hydrate walls of the, see, have a look at this case. Eyeball is rolling upwards like this. So you just need little exposure to fit this cannula and do good hydrodissection. Case of ICL, again Hydrostitch is done. So these are small modification, but these cannulas are very useful and handy, and you can try these cannulas and let me know your feedback. Thank you very much, sir.
Thank you. It's a very wonderful innovation. So the hub of the needle is of stainless steel.
Yeah, I forgot to tell you one thing. It's very important to use Lear-Lock mechanism for viscoelastic cannula. It's written also on the packaging because the force which is needed as compared to normal cannula is little bit more. Right. So it may jump off if you don't use Lear-Lock syringe. So it's very important, and I'm very sorry I forgot to mention that. It's very important that you use Lear-Lock syringe. Like I use Upper Visc PFS, it comes with the Lear-Lock syringe. So we just screw it tightly and you check it before using it. So that's one caveat.
Yeah, this is one question actually I want to ask you. See, you said it is 27 gauge, right?
It's Visco is 25 gauge, and that one is 27 gauge.
Okay, Visco is 25 gauge.
Yeah.
So that means, HPMC, injection of HPMC will require a lot of force.
Not lot, sir. I'm using it for last 2.5 years. Yeah. Now I got used to it.
So that is the reason we had the protective mechanism of having the lower lock.
Yes,
yeah,
yes,
I think
that's very important.
That is a very nice thought process. And the second thing I want to ask you, these are disposable ones or?
So these Epsilon is manufacturing, these are the reusable ones. And Ovation is there in Jaipur, they are manufacturing, those are disposable ones. And one more company in Jodhpur is making, those are also disposable.
This 90 degrees, 78?
It's 85 degree around,
yeah, so
not exact 90.
How easy it is to clean these at the end of the surgery, the reusable ones?
So normally we just, as we do with any other cannulas, just flush it with, our assistant do it with the normal distilled water and then with the air, and that's how they clean it.
Like any ultrasound cleaner is also can be used for a cannulated instrument.
So I think you need to emphasize on this fact that, for example, if you're talking about posterior cataract where visco displacement is contemplated, it is basically HPMC that you're using and the lower lock facility, that feature.
Yes.
Otherwise, the injection becomes quite uncontrolled. You definitely use more force to push it in.
Yes. So
even
if
if it is
I
25
tell in
gauge,
percentage, it's of course 10 to 20% more than what's normal
How to
HPMC goes to
calculate the
normal
percentage?
cannula. It's just my,
Your
I can,
clinical sense,
yeah,
yeah.
by my feel I can tell, of course. That's why I said it's very important to have a lever lock mechanism for this.
So that means in PCRN situations where you're supposed to inject OVD
Yes.
immediately into the anterior chamber, so normally we make a small paracentesis, and if you have a PCRN, before you take out the phaco piece, we inject viscoelastic into the anterior chamber. So that cannula, I think, is quite thick. It doesn't go through the unextended.
yeah.
So many people keep end up injecting the OVD at the wound,
Yes.
and that may go into the subdecimate space and
Yeah, true.
create a DM detachment.
And that time everybody is tensed, you know.
Yeah.
So their
So
hands
this
are
will be- this
shaking.
will be
You're not
useful,
able
yeah.
to go inside. It has a, and moreover the end is tapered.
Yeah.
So it's easier to insert it. So I told them to make a mechanism that, you know, ergonomically, if you see, if you have something like you're holding bimanual cannula, no, they're very easy to insert. Whereas if you are holding a syringe and then there is a cannula, it's difficult to insert. So I told them to make a mechanism where we can easily insert it and have a pinch mechanism so that, you know, visco can go inside. So we are working on that.
I will just add one more thing with that Hydrostitch. Just it's coming to my mind. You can, like, it's also it should help in reducing the incidence of DM detachment, because with the straight cannula, if you do some kind of during most of the DMD occurs
Yeah.
while you are doing the stone.
Hydrating the wall of the
What do you say, sir?
And we are right, absolutely. Yeah.
Yes.
So Harshul, you have given us, Harshul has given us hydro-free oil implantation. Now you have given us,
hydroimplantation.
hydro-implantation. You have given us hydrodissection, cannulas and all these. So wonderful, innovative thinking. Keep up the good work and help ophthalmologists, your fraternity all over the world.
Yeah.
Harshul, what is
Any more
the
questions for
size of the bend?
Size?
Size of the bend,
That is 1 millimeter.
1 millimeter. Okay.
And our side ports are usually 1.2.
Yeah,
So it fits in easily, you know, so.
you're using it as your Sinski also. You're using it like a Sinski.
No, not Sinski. So another advantage of visco cannula which I didn't show here is I use it to tug ICL plates also, you know. Because of smooth curve and because of the tapered end, it's blunt. I don't have to use the extra rod which comes with ICL. So, and moreover, wherever I need, I feel if chamber is shallowing, I just again inject visco and use the same cannula to tug the ICL plates. So it helps in that also.
So thank you.